hopefully not more contracts with those sort of settlements. Over to James Wilde MP, Mr. Wilde.
Thank you, Chair. Dr. Harries, thank you for your letter updating us on the use of management consultants within the organisation. I think it's just worth putting it on the record that on the 31st of January there were 1,476 management consultants, and you were paying day rates of up to £3,100 per day. What does someone do for £3,100 per day?
Very few of those management consultants operating. Our average cost is £1,244, and all of those costs, whilst I know they will feel, again to many public viewers, very high, they are standard contract costs drawn from government contracts. So we're using all the systems in place to ensure we get the best value for money. I think the most important thing is about whether we are reducing them. So as a leader of a new organisation, I am very keen, particularly one which oversees the health security of the nation, to ensure that we have a very strong, stable civil service workforce. You will probably have seen from that letter, if you work it through, we have had only 31.9% of our workforce in substantive civil service positions, and I think that gives an indication of some of the problems of trying to maintain and safely transfer over, for example, technologies that have been developed for COVID into our standard process. So we, since the one, we have taken another 71 consultants out. Our civil service civil service component is now going up, so it's 58%, it's up to 61%. But I think the real trick here is, obviously, with the Living with COVID programme, we are rapidly downsizing and taking away a large chunk of those things appropriately for the current prevalence levels. And as soon as we land some of the infrastructure that we've developed for that we want to take forward for health protection, then clearly we will be able to take out some of those consultants. And the final thing I did just want to point out, which is in the letter, it's quite confusing in public health terms, a clinical medical, so I'm a medical consultant in public health. It's really important because some of our workforce who have worked right through the pandemic will get mixed up with management consultants and quite rightly feel concerned that their work isn't recognized.
Absolutely, no, the letter's clear on that. You've got 1,476 management consultants, but in what area would someone be earning £3,100 a day, given the length of time that Test and Trace and this organisation's been in existence?
So the focus of this has now changed. As I was saying, the majority are not, because
but specifically on that rate of up to £3,100 a day, what area would they be working
So
on?
these are partners or directors who might be overseeing, for example, transfer of national digital infrastructure. They're particularly in areas of work which are not typical civil service ones, so digital IT technology, and trying to move systems across. So if I just use a practical example, vaccination system, for example, where we've had real-time vaccination, which has allowed us to reach out to communities and ensure we try and manage infection rates, we now have a digital infrastructure which we have to transfer over to a longer-term basis, and it's exactly those sorts of very significant, quite complex programmes that it's that sort of management system.
So how much are you spending every month on consultants? Because there isn't actually a figure on spend within the update letter, it's just numbers of people.
I'm very happy to come back with that
Perhaps
detail.
you could include that in future updates, because it's quite a material fact. I mean, you have been spending well over £1 million a day on consultants.
Yeah, very happy to. I mean, just pointing out that at the peak of this in February 21, we had 2,586 management consultants. So it's just, we are coming down. We did have to ramp up again a little bit for the Omicron wave, again, only in response to a national health risk.
Okay, well, Ms Studd, in July last year you told this committee this was a really sharp area of focus, that you wouldn't take your eye off the ball. In March you told us that there was a detailed plan. Dr Harries, in July last year you told us there was a very detailed ramp down plan. So what is the plan? At the end of the plan, how many management consultants will you be using?
We will have zero, except where we have services which we have no civil service capacity to do that. And I say most of that, if I just focus on digital and infrastructure, is one of the areas where we are reviewing the whole process. It's quite important as well to realise that we have merged 3 different systems. So since that time and now, we are actually more complex than we were a few months ago. But the intention would be to have an absolutely stable civil service workforce, and that will be good for my workforce and it will be good for the public.
Okay, you've told us several times that there's a plan, so by when is that the plan to have that actually effective?
It is, but we are in...
By when?
Well, I'm just going through a strategic plan now. Our business budget spending review settlement was completed on a one-year basis on the 30th of March. And we are now just midway through May. So we are working really hard to do that. I'm very happy to send that. We do have detailed plans. We did flex a bit during Omicron for, I think, the right public health reasons. And the ambition is to come down to 0.
But in 3 months, are there going to be around 1,400 management consultants? If not, how many are there going to be?
Absolutely not. But at the moment, the Living with COVID plan means we are having to decommission services as well. So in decommissioning, for example, we are taking out all of the physical test sites. So having senior consultant across this with very significant decommissioning costs themselves, returning them to local authorities or local landowners, whoever it might be, is a temporary but quite significant change process. So for those ones, that's why we've probably still got more here than we had. It's the pace of change which is an important factor. But when we get to a stable point, and I think I'm due to send you a letter at the end of June anyway, and again, very happy to continue this and put in the figures that you said.
Okay, I mean, I think my constituents certainly would want to see this spend come down rapidly. You've told the committee several times you have detailed plans, ramp down plans. You said you want to get to 0, but you can't give the committee any indication of when that might happen.
I will be able to very shortly. As I said, we have only just got a budget, and we have both...
But when you came to the committee in March and said you had a plan to get to reduce the number, what were you aiming at that point?
It was on a slightly extended plan, and in fact what we've done, partly linked to the epidemiology and the fact that vaccines have been so successful in therapeutics, is the Living with COVID approach has come in sooner. So we are both ramping down the COVID ones extremely quickly, but also building up a public health organisation, and it's really important that both of those happen. It's quite a complex process, but I understand the point that you're making.
The final one, Chair, because I don't think we're going to get any figures, but Ms Dunn, how are you holding UKHSA to account to actually deliver? You said you weren't going to take your eye off the ball. We don't have any plans, any numbers of what date we're going to have a big reduction in use of these very expensive management consultants.
As Dr. Harries has described, we had a detailed plan from UCSA and from its predecessor bodies. That detailed plan was shared with ministers. Ministers signed that plan off. Ministers had regular updates on that plan from Dr. Harries and her team. As Dr. Harries has described, then some of the plans around the trajectory within that plan changed, partly as a consequence of Omicron, partly as a consequence of the Living with COVID strategy. Those revised plans are the ones that Dr. Harries has referred to, currently taking through her strategic planning process. All of the data that Dr. Harries will write to you on and that she's referred to here is fully transparent with the department, and ministers see that data as they do the data for the department more broadly. So there is rest assured with the formal creation of UCSA, there is no reduction in visibility of the plan to reduce this significant expense.
Okay, well, there's a plan, but it doesn't have any numbers. I think we'll be returning to this